Coming of Age is coming up next. I'm your host, Emily Echeverria. First today, we're talking about an important cornerstone of healthcare management, your primary care physician. We'll tell you why you need one and what to discuss at your annual visit. Next, we'll talk tips and resources for fending off the challenge of caregiver burnout. Finally today, 'tis the season for spring cleaning, and we've got a professional organizer here to help tackle those trouble spots in your or your loved one's home. Stay with us. Coming of Age starts right now. As we age, staying active and connected to community can sometimes become more challenging. But with Council on Aging of West Florida's broad range of home and community-based services, you can stay healthy, independent, and engaged in life. From Meals on Wheels and respite care to senior dining sites and the retreat, we provide the support and connection you need to age your way. Aging is a unique journey for everyone, and we're here to help you meet your needs and thrive while preserving what makes you, you. Since 1972, we've been a trusted advocate for elders and a support system for those who care for them. Now, let's dive into the age-related issues that matter most to you. Your annual visit to your primary care physician is an invaluable step in maintaining good health. Here today to talk to us about why it's important to have a primary care provider and what you should discuss with your provider at your annual visit is Traci Bourgeois, family medicine physician at Baptist Medical Group Primary Care Office in Gulf Breeze. Thank you for joining us today.
Thank you for having me.
So why is it important to have a primary care physician?
Primary care is really important because your primary care doctor is really meant to be the hub of your health care, in which you form an ongoing partnership with your doctor to treat chronic medical conditions, but to also help prevent or improve many conditions such as diabetes and cancer, including lung, skin, cervical, and breast cancer. Having a primary care doctor can greatly improve one's health by giving patients better access to health care, which can improve health outcomes.
And how can having access to a PCP improve one's health? I know you just kind of went over some of that.
Right. Many health conditions, unfortunately, such as diabetes, high blood pressure, don't have symptoms that would lead a person to seek primary care until those issues that you have cause conditions such as heart attacks, strokes, or severe kidney disease. Many patients without PCPs unfortunately find out about these conditions when they present to an emergency room after having had a stroke or a heart attack. PCPs screen patients for high blood pressure, and we also screen patients who have risk factors for diabetes so that we can hopefully catch this disease before it becomes widespread, and we can give a lot of interventions in the meantime.
Well, some patients are apprehensive about going to the doctor for that annual visit for fear of the unknown. What advice can you give to a patient who's nervous about coming to see a PCP?
I always let patients know that health anxiety is a very common issue affecting many people. Doctors, as a result, are often very familiar with this, and we can help alleviate a lot of your anxiety. I always let my patients know that I won't do anything without their permission, and I really feel the relationship between a doctor and a patient is sacred and really works best when we work together as a team to decide on treatment plans and wishes.
What are some things patients can do to improve their health as they age? So we know, there might be some kind of decline in different conditions. What can they do as they age?
I find that most patients don't mind getting older, they mind feeling older, and they mind often looking older. And while I believe it's a privilege to be able to age, we can often feel better or look better than our biological age by regular exercise, such as walking, chair yoga, quitting smoking, and skin cancer prevention.
Speaking of skin cancer prevention, what can a patient do to help prevent skin cancer?
So skin cancer is actually one of the most common types of cancer, but it can be avoided by taking precautions when you're outside, such as wearing long sleeve clothing, wearing a hat, using sunscreen, even on a cloudy day, because most of the UV rays pass through clouds.
Here in Florida, we have a lot. Long sleeves, that's going to be kind of a non-starter for several months of the year. And we have a long history of years of skin exposure to the sun. So what can patients do if they've already spent a lot of time in the sun?
Well, I always tell patients it's not too late to begin wearing sunscreen and wearing a hat, but yearly skin exams are very important, and your PCP can assist with this. Also, paying attention to any changes in your skin, such as moles that are changing shape or color, or skin lesions that bleed with just minor pressure on them. That's really important to note to your doctor because these can represent skin precancerous lesions or even skin cancer, and early detection and treatment can prevent death and disfigurement from skin cancer.
You mentioned smoking cessation. If patients are interested in quitting smoking, how can their PCP help?
So PCPs can often help with helping a patient pick a quit date where we make resources available to patients, including medications that can assist with quitting smoking.
And if a patient worries that quitting smoking won't improve their health if they've smoked for, say, 35 years, what advice would you give to those patients?
I tell patients that quitting smoking can have immediate effects on your health, such as lowering your blood pressure. Also, cancer of the mouth and esophagus decreases in half within 5 years after quitting. Also, the risk of lung cancer drops by half within 10 to 15 years after quitting. Also, even if you are a smoker, lung cancer screenings can be ordered yearly for patients aged 50 to 80 who have 20 to 30 pack years of smoking history. And these screenings can really help detect lung cancer at treatable, curable stages.
And what advice would you have for someone who just hasn't gone to the doctor in a while and they need to establish that relationship with a new PCP?
I always urge patients to give us a call, schedule, and then make a list of things that you're most concerned about. Often I find that patients were always afraid to ask if they might have a cancer or they want to be screened. And I never mind patients coming in with a list of their questions to help keep them on track.
Excellent. Anything else about the relationship with a primary care physician that you want to bring up?
I just think it's really important to have a very good relationship with your primary care doctor. I know in this area finding a primary care doctor is very difficult, but I do urge patients that we do keep everything confidential. I'm happy to discuss at your appointments anything we can do to improve your health or anything you wish to discuss with me further.
And what about referrals to specialists?
So we really are the hub of healthcare for patients. And when patients come in, there are many issues that I can handle myself. But sometimes I do refer out. We can assist with that. And we have a referral coordinator who would actually work with your insurance to see which providers, specialists, take your insurance so we can make sure you receive the right care with the right specialist.
Awesome. Thank you so much for sharing this with us.
Thank you.
Next up, we've got resources and advice for facing caregiver burnout. Stay tuned.
Navigating healthcare is hard. Baptist makes it better. With convenient locations, easy scheduling, and skilled, compassionate doctors, all when you need us most. The next time you need care, let Baptist make it better. Baptist Healthcare.
The Reesburg Institute, Pensacola's Ear, Nose, Throat, and Voice Center. We welcome you to visit us at our convenient Davis Highway location in Pensacola. At the Reesburg Institute, we offer the most advanced treatment available in a calm, stress-free environment. Since 2014, we've performed over 1,000 cases in office of balloon sinus surgery, as well as septoplasty and nasal procedures using oral sedation. The in-office procedures result in a faster healing time. Visit us and feel the difference.
Animal Allies is looking for volunteers, and there are many ways that you can help. From taking care of cats to using your computer and social media skills, any and all assistance is greatly appreciated. We have morning and afternoon shifts every day or help at adoption events. You can even foster a kitty at home. And it counts towards community service hours for bright futures. Find Animal Allies Florida on Facebook and Instagram or go to aaflorida.org/volunteer.
Keeping your family healthy can be complicated. Baptist makes it better with trusted primary care doctors for the whole family and trusted specialists at convenient locations throughout the region ready to care for you. All when you need us most. Let Baptist make it better. Baptist Healthcare.
Caregiving for a loved one is a journey of compassion, patience, and for many, great challenges. We're diving into an issue that many caregivers face but often feel guilty discussing: caregiver burnout. Sharon Oakes works for assisted living locators and facilitates many caregiver support groups, and she's here to discuss the strategies for maintaining well-being and finding support while caring for loved ones. Thanks for being here, Sharon.
You're welcome.
So first of all, what's the most common signs of caregiver burnout that people might not recognize immediately?
Well, initially it's fatigue. You're tired. You'll see a lot of you sleep too much or you sleep too little because you're always on edge. We see a lot of people, because you're so busy caring for somebody, you don't cook, you don't have time. So what are you eating? Junk food. Is that healthy? No. So you're either eating too much or too little. So you'll see a weight gain or a weight loss. Also health problems for yourselves. I mean, you may not have had any issues with diabetes or any kind of kidney issue, and all of a sudden you're getting urinary tract infections and other things are surfacing. The other part of it is isolation, because you're so busy caring for somebody that you don't get out, do the things that you love or you used to do and enjoy. And that can be a huge, huge problem. You also become depressed. And a very nice person who was very kind all of a sudden becomes irritable, brusque, short-tempered, and angry.
And we've definitely seen that in our line of work for sure. And a lot of caregivers will feel guilty for experiencing burnout or wanting time to themselves. So how can they reframe that perspective and understand that taking care of themselves isn't some selfish endeavor?
We talk about this a lot in our support groups. Guilt is a wasted emotion, and trying to explain that to people, but they have to absorb it and relate it inside. What you have to do is, like you said, reframe it. I always tell them, well, what happens if something happens to you? You go in the hospital, you pass away. There's a 63% mortality rate, and I just checked it this morning. For people 66 and older who are caring for somebody, they die before the person they're caring for. Wow. 63%, because we're aging and our bodies weren't designed to live to 100. So at this point, I think that I have to tell them, look, you got to stay healthy for you. And that way you can care for your loved one in whatever way you are able to do.
And what are some strategies to do that, to protect mental well-being and physical health?
You need to check resources for people who are caring for somebody. Respite care. Take a 7 to 10 day and go visit your grandchildren somewhere. Yes, it costs money, but if money is an issue, you can also rely on friends, family. Now, some of our family is more receptive than others. We always have that one sibling that will take it all on and the others don't. But you have to research that yourself and put a group in place. And part of the problem is we don't like to ask people. Mm-hmm. We are an American culture. We can do it ourselves. Many caregivers feel they're superheroes, more common for females than males. And they think they can do it all on their own, and they can't. Mm-hmm. So convincing them that even if you get 2 or 3 hours twice a week, that you can get a friend to come in and sit with your loved one. And that's better than nothing. But you can have paid caregivers too. There are agencies in town where you can pay. The average price is between $27 and $35 an hour. And you can get somebody to come in on a regular basis, and you go get your hair done, go to the beach, go for a drive, whatever. And that helps you stay healthy.
And I definitely think that asking for help can be such a huge challenge, especially when it's a retired nurse, for instance, or it's your parent and you feel like, I should just be able to do this.
Social workers.
It's my duty. Social workers, this is my duty.
Yeah.
So how can caregivers prepare themselves emotionally and physically for the changing needs of their loved one, like if someone's just starting out that journey as a caregiver?
And that's something we do in our support groups, but it is my privilege and also my goal in this community, and I've been doing it for 10 years, is to go out and educate people how to get old, how to have everything in place, your legal, having the conversation with your children, making sure they know how do you want to be buried, do you want to be cremated, have those death talks. Looking at the option of hospice. Hospice is a wonderful resource. Medicare pays for it, so if you're over 65, you're okay. And that having those things in place, it takes a huge burden off your shoulders. It really does. And having it, I call it the red box, and I've done that talk many, many times, about 30 times a year actually. Mm-hmm. And it goes from what's your plan as you age, all the way to the end of life. And it's practical, useful information, and people need to hear that kind of information so they can prepare and they can have it in place, and whoever's going to be after them, children or spouse, whatever, they have the benefit of being able to mourn them and not be stuck with the junk of dying.
Yeah, and answering all those different questions that you have to answer at a time when you're grieving.
Right.
So what advice do you have for building a support network, whether through family or community resources?
Well, nowadays you've got Alzheimer's Association, you have Parkinson's groups, you've got cancer survivors. There's so many groups out there, and go on Facebook. I mean, that's a wonderful tool, but reach out to your friends. Who have they used? If you are a senior and you're mature, you've got a lot of friends that have been down this road before. Use them. They want to be used. We forget people want to be useful. As we had struggles, we want to make sure that we can return that. So don't be afraid to ask them to help you, especially when it's something that they've had to journey through, and now they can help you, support you emotionally, as well as give you some practical, useful resources. This community is wonderful. We have lots of resources, and we need to be able to get that information to others.
Absolutely. So what's one practical thing that caregivers can do to take care of themselves when they are feeling overwhelmed, when they're just hitting their limit and they just need something to kind of get out of that?
Give themselves permission to get somebody in there at least 3 hours a week so they can get out. You feel like you're isolated with your loved one and you love caring for them, but you still need to make those connections, because after your loved one leaves, that leaves you. And you've broken all your connections. So make sure that you maintain that, whether it's going out to lunch, whether it's picking up the phone outside of your home. Make sure you have somebody in there at least 3 hours a week. And you go out and have some fun, whatever that might be.
Yeah, or take a nap if you need it.
Yeah, that's right.
Great advice. Thank you.
You're welcome.
Next up, we're tackling home organization with a professional. Stay with us.
I don't know why you're so sad. You've got a roof over your head.
Bro, you gotta stop with that depression stuff. That's a white people thing.
Escúchame, en esta casa los hombres no lloran.
You alright?
It just feels like it's coming from everywhere.
Do you want to talk about it?
Thanks for hearing me out, bro. Appreciate it.
You can talk to me if you're feeling sad. Whenever you need to talk, I'm here, okay?
When it comes to making plans, you are the best. What about those barbecues you plan in detail for your family? Or your daughter's first costume party? It was out of this world. The same way you plan each detail for those moments, start planning to protect you and your loved ones from a natural disaster. Sign up for local weather and emergency alerts. Prepare an emergency kit and make a family communications plan. Protecting your family is the best plan you can make.
¿Qué color? Perfecto, mijo.
Gracias. Thank you.
What's wrong, mijo?
Donating to a pet's medical care is one of the many ways you can help families in your community. Pets and people belong together. Learn more at petsandpeopletogether.org.
Managing all the stuff of a household is a never-ending task, and our home organization needs shift as we age. Whether you're looking to downsize or rearrange furniture to accommodate a mobility device or just freshen up your space, Sharon Davis of Efficient Home Organizing can help. We're talking today about decluttering, downsizing, and the best ways to create a safe, comfortable living space. Thank you for joining me today.
Thank you.
So first of all, tell me about your business and the services you offer.
I've been in business almost 20 years, and I help homeowners in the Pensacola area with decluttering, organizing, and teaching them strategies and systems to help them stay organized. I specialize in chronic disorganization, hoarding, ADHD issues, and aging. And I also offer packing, unpacking, and downsizing services.
Excellent. Definitely much needed for many of us. Talk more about your specialization with aging and the issues with organization related to that.
Seniors generally have issues with chronic disorganization due to mobility challenges, cognitive decline, depression, and other physical and mental health challenges such as loneliness, depression, isolation, or poor nutrition even.
Interesting. Let's talk about safety. What are those safety issues that an older adult might deal with their home organization?
Well, when they get too much clutter, it tends to be on the floor. If they have mobility issues, it's hard to put things away. So we want to make sure on the initial visit that we see clear pathways, and if there are not clear pathways, we want to address those issues, make sure that the home is safe so that they can move a walker through or a rollator or something like that, that they can get in and out of bed safely and get to the bathroom, that they can use the kitchen and prepare a simple meal.
Mm-hmm. And downsizing is another big issue that we're talking about. What are effective strategies for supporting seniors through that process?
First of all, downsize in stages. Don't wait till the last minute. Think about your current lifestyle and the things that you're doing right now. You still want to be active. You still want to do some of the things that you have loved to do for many years, but maybe you just need to downscale it. And then you can let the things go that you once did but don't do any longer. For instance, if you used to entertain large parties, you don't need those entertaining and large serving trays anymore. Maybe you had a wardrobe, a professional wardrobe, or you used to golf or play tennis and you're no longer doing those activities. You can maybe let those kind of things go.
And it can be hard to, close the chapter of your life and admit that that time is no longer.
It is, but that's my job, is to coach them to accepting, hey, you can still do some really cool things right now with your life and have a fulfilled life.
Absolutely. Hoarding can be a big concern for older adults. So how can families or caregivers see the difference between kind of sentimental attachment and maybe something that's becoming potentially harmful or hoarding situation?
Well, hoarding is a mental disorder, and it's classified in the Diagnostics and Statistics Manual for psychologists. And there are 4 factors central to compulsive hoarding. Excessive accumulation is one. Difficulty discarding objects that most other people consider useless or of limited value. Clutter is also so severe that it prevents or seriously limits use of the living spaces. They've hoarded, stacked things in the bathtub, and they can no longer get a shower. The clutter acquiring or difficulty discarding, those are important key issues, is the acquiring and the difficulty discarding raises significant impairment or distress. They get very anxious. So those are the main issues with that. Some of the other thinking styles that go along with hoarding, which is why it's a mental disorder, is that possessions provide emotional comfort or safety, and they feel like they have to keep it to avoid that anxiety, or possessions have special value and they must be saved, or they feel like they're the caretaker of these items, and so therefore I must save everything.
And what are kind of the steps to take if somebody does see that situation starting to bubble up with their loved one?
Well, I would say the first step is I could come in and tell them, is is this hoarding or is it just chronic disorganization? Sometimes family members see excess clutter and they just think, oh, it's hoarding. And I was like, no, not really. So I can do an assessment, and then I also would recommend that they get some licensed mental health counselor involved, and I have worked with licensed mental health counselors in conjunction, collaboratively with them, because they can help in the process of changing the thinking in the office, in the clinical setting, but then I can help in the home and implementing those changes. And then the other thing that would really work is if there's just really a lot of pushback and stubbornness in change, is just to create a harm reduction plan, and that is part of a just making sure the home is safe.
Mm-hmm. And I think, we think of home organization or decluttering as kind of these just, it's a little bit superficial, it's just about making your space look nicer, but we don't think of it as part of healthcare, having a safe environment, having an environment that is conducive to, a healthful life. So with letting go of items, that's hard for anyone, but how can seniors and their families approach the process of letting go of items to declutter, to get more organized?
Target one small area at a time. That's the key, because if you look at the whole project, it's overwhelming. So just start with the obvious: trash. There's trash everywhere in our home, even tucked away, dead batteries somewhere in a drawer. Move on to other categories that you're not passionate about. So maybe they no longer decorate for the holidays. All right, that would be something that could go. And maybe they're not doing yard work anymore because they can't, and they have hired someone to do that. So yard tools could maybe easily be eliminated, things like that.
So start with those low-hanging fruit and then let that motivate you to kind of
yes,
continue
because
with
once
this.
you start to get into more sentimental items, if maybe they were a librarian and their former life and they love books, that might be a hard category to get into.
Yeah, so don't start with those harder, more emotionally charged.
Right.
Great advice. And gives everyone a place to start with their spring cleaning for
yes. These are some excellent resources that you can turn to for extra help.
Thank you for joining us.
Okay, thank you.
And thank you for watching. Until next time, enjoy life. You've earned it.